Dear students, welcome to Game 58, Gross and Microscopy Explained. I hope you are able to identify the couple of pictures on the screen. Of course, this might be kept for you, this not necessarily. And the diagnosis is hydrocele. Sometimes simple things are more complex. I always pity a student who has got an appendix for description, whereas his friend will be having a cirrhosis or something else. Appendix will be more difficult to explain. Similarly, in this case also, this is the specimen. There is an abnormal and a normal. Let us see what is going to happen. This is the penis and this is the scrotal sac. There is a testis and the epididymis. And in this case, I find that there is a bulge within and there is an accumulation of fluid leading to what is called as a hydrocele within the vaginal sac. This again is a three-dimensional one, a beautiful picture that has been reconstructed. It is not just on one side, but it is encircling the entire testis and the parenchyma, and I can see through it. So in this case, it is transparent. We shall come to that at a later date. So this is the cord over here, the epididymis. There can be an epididymal appendage, and there is a testis with a testicular appendage. These are all some structures just for recollection. A normal testis, and then here there is a hydrocele. The same thing over here. I would like you people to kindly appreciate the somatic cord. And this is a hydrocele sac over here. This can be a specimen for you people. In this, I'm finding various structures such as the cord. There is a tunica. This is a thickened tunica that I'm seeing. Opacity, it is not transparent. It does not allow light to pass through, which means it is thick. And the inner surface is rough. We call it as rugus. And the testis is here not affected. I would like to mention the dimensions of this one, dimensions of the sac, thickness or the length of the cord, thickness of the sac, etc. That is how you people score the mark. Similarly, you will have to describe the external surface. And now what exactly is the hydrocele? This is a note that I have taken from the net. This will be sufficient for you people to answer surgery. So it is a large hydrocele, fairly common. Sometimes it can leave a larger size or smaller one. Clear fluid is accumulating. I find that I can almost see through it. It is called as transparent or lack of opacity. And it is a remnant of the embryonic process vaginalis. Sometimes it can arise because of inflammatory conditions, or sometimes it can just be a transudate. Transillumination will help us. They would have taught you in surgery, of course, you will have to answer. And the testicular mass will be opaque. There is a testis over here which is opaque, whereas here the light is being allowed to pass through. This is just for comparison, another case which can also be kept for you, a torsion of the testis leading to a gangrene. Please describe. This is what you people are supposed to do. This is an orchidectomy specimen, measuring dash into dash into dash centimeters. 3 dimensions. The length, the breadth, and the third dimension will be the thickness. External surface. Here I am seeing only the cut surface. You'll have to mention whether it is smooth, grayish white, whether it is opaque or transparent. The cut surface, it shows a testis which is having yellowish patches, and then it is yellowish white over here, well circumscribed. It measures dash into dash centimeters, well demarcated. There is no tumor in this. The sac measures so many centimeters. Here I am able to find some congested blood vessels. This is the inner lining over here. Compare it with this specimen. Here again, the testis is almost normal, well demarcated, no pathology as such, no tumor, no areas of hemorrhage or necrosis. But the sac is obviously thickened and it is rough or rugus. I'm able to see about maybe 0.3 centimeters of thickness is over here, which means it has been a chronic lesion. Therefore, it has led to chronic inflammation, fibrosis, and opacity. This is what I mean. telling you people. This is a tunica that has been thickened and it is composed of fibrocollagenous tissue, a chronic inflammation with multiple cholesterol clips. This slide will definitely not be kept for you people, but as a mark of completion, you people can know this. And you people should read R.A.T.S along with game. See you in game 59.